Good morning, I'm Dr. Lemper, and today I'm being asked questions about hand pain and wrist pain. There seems to be a lot of confusion out there as to everything that hurts isn't necessarily responsible for the pain genesis or the origin of the pain. There's lots of pains that we have in our bodies called referred pain. Headache is the prime example. Most of the time you have a headache, it's not because something in your head hurts. Yes, that is true of sinusitis. Yes, that is true of a brain tumor. But in general, 80 to 90% of neck pain will manifest through all the musculature on the back of the head and irritate these nerves that come right through here and control over your ears, over the top of your head, and directly behind your eye. And those are the occipital nerves. The greater, which comes over the top of your head, because it's on top, so it's king of the hill, and the lesser goes over your ear. That has nothing to do with wrist and hand pain. However, that's an example of how pains are in areas of your body, and that area of your body isn't responsible for the pain. So when somebody comes in to see me in my office and their main complaint is carpal tunnel pain, first thing I do is figure out how they were diagnosed. Were you diagnosed by physical exam? And if you were diagnosed by physical exam, did we rule out secondary causes, specifically a pinched nerve in your neck or any other aspect of your arm? What I do notice is that in general, if a patient comes into my office, I ask them a couple of very specific questions. Does it hurt when you squeeze the area that's in pain, or do you get relief when you squeeze the area that's in pain? Reason being is referred pain is a pain that's caused by a pinched nerve in your neck that sends a message to your wrist or your hand or your fingers. And if you rub and squeeze those fingers and you actually feel better, that's a phenomenon called counter-irritation, and that's a telltale sign that you have a pinched nerve and referred pain to the area. If in fact you do squeeze your wrist and it hurts worse, or you can tap on the inside of your wrist and you get tingly sensations to your middle finger, that is a diagnostic sign of carpal tunnel. Soft signs of carpal tunnel are difficulty putting your wrist together in this fashion. That's called a Phelan's sign. And these things are physical manifestations of a wrist problem that will cause an irritation to that nerve that will cause carpal tunnel. As well, your lifestyle. Do you do certain things all the time that causes wrist pain? Most of the time people complain of wrist pain while they're typing. That's still confusing because most of our keyboards and mouse pads have these anti-carpal tunnel type bumps on them. And what these do is they put your wrist in the right position so that you're not awkwardly stretching that nerve or irritating or compressing that nerve. Wrist pain while you're typing very likely comes from the neck looking down. And if you think of a disc problem or a pinched nerve in the spine, you have to think of a jelly donut. A jelly donut with a hole in the back. Anytime you look down, you're taking the jelly in your disc and pushing it out. So if you have like two thick buns on a hamburger and you push the front, you're going to spit the patty out. Well, same kind of thing is happening with your disc. You have a gel-like material inside your disc. And in your neck, if you look down and you have a bulging disc like this, and you look down forward, you're going to make that bulge out further. Same thing in your low back, same thing in your entire spine. Forward bending causing pain to refer down an extremity or into the axial spine is very likely a sign of a problem within the spine. Just some things for you to think about. So not everything that hurts is always the cause of the pain. Thank you.